came out of the shower, as I was drying, I felt a little lump in my left breast. And it was established that it was stage 2 cancer, breast cancer. What is very sad to me is, there's so many people out there that I saw in that chemo room that don't have the money to pay for it.
Nowadays, even it's better if you are HIV than if you have cancer, because cancer is a killer disease. Even if you get treatment, cancer treatment is very expensive. If you are living a poor life like now me here, you can't manage it.
The journey for our cancer patients, they navigate the health system for about close to 6 months, sometimes even 1 year. They waste time within the health system being treated for many other conditions before cancer is finally diagnosed.
So by the time they get diagnosed, usually late stages, and then they get sent back for palliative care. It's very difficult for us to care for the patient at that stage.
It's the burden that is on the services itself.
Yeah.
It's a heavy burden.
Yeah.
By the time the diagnosis is made, it's mostly too late.
The treatments are so expensive, it's unaffordable by individual, by the programs, and as well as by the governments. And now with these partnership between the innovator and the generic companies, now some of the molecules are being available, which are affordable, for people with cancers in resource limited settings.
We got our first license last year for a chronic myeloid leukemia drug, and we know that a lot of drug companies are looking at this to see how this does. And if it does well, then I really think that we'll have more licenses. But it's still something of a fight for us to get them. And that's a pity, because the whole point about intellectual property is it's supposed to do 2 things. It's supposed to, by giving monopolies for a defined period, incentivize innovation. But it is also supposed to deliver access. I think it's really important for the drug companies to understand, from a political point of view, this enormous pressure from lower middle income countries to have access.
From access point of view, if you want to make a good impact, then cancer would be next therapy area where we should have our foot in. And that is when this nilotinib license, when it was presented from MPP, we were quite excited to have it.
Medicines patent pool can play a very valuable role in terms of access to cancer treatments. And that is specifically if we start looking at treatments that really are effective and that can improve outcomes, treatment outcomes. If those products are available through voluntary licensing, then people will be able to access those products as well.
My name is Shrikant Mutineni. I take care of the multiple plants of MSN Laboratories. I ensure that the products are delivered on time in full every month. Block C deals purely with oncology products. We have high-end machines, and they are fully automated.
I think medicines patent pool has a huge role it can play in this space of access to cancer medicines. I believe that we can get more innovator molecules licenses so that we can be able to have them more available.
The affordable price, that's very important. When it comes to oncology, the pricing is very, very high. Probably next 5 years, because of our continuous efforts, and it will become affordable to anyone across the globe.